clinical approach to acute and subacute quadriplegia in children. Subacute quadriplegia in children. Subacute quadriplegia in children. Acute quadriplegia should be evaluated with a thorough neurological examination. The objective of the evaluation is to localize the disease process based on the history and physical examination. The failure to detect this condition early can lead to permanent disability. This article discusses the clinical approach to acute and subacute quadriplegia in children. A comprehensive neurologic evaluation is essential to determine the diagnosis and the appropriate treatment options. The clinical approach to quadriplegia involves treating the condition in the best way possible. The disease affects the brain, spinal cord, and limbs. The spinal cord relays signals to and from the brain. The brain processes these signals through the spinal cord. An injury to the spinal column prevents the brain from sending and receiving signals, which in turn impairs the patient's ability to function. The physical and mental aspects of quadriplegia are also impacted by the lack of ability to move. Most cases of quadriplegia occur due to violence, especially among young men. 60% of all sports-related spinal cord injuries are caused by falls. Trampoline accidents, diving accidents, and botched spinal surgeries are all possible causes of this disease. In rare cases, a disease of the spinal cord may cause loss of limb function. A proper medical evaluation will determine which pathology is causing your paralysis. The clinical approach to quadriplegia is a crucial part of the recovery process. It is important to recognize that not all patients will experience the same degree of disability. There is no single treatment that will help everyone recover, and there is no cure for the condition. The most effective approach is to monitor your progress and ensure that your recovery is as smooth as possible. While this may seem a tall order, it's important to remember that a proper diagnosis will help you avoid unnecessary complications. As the condition progresses, a quadriplegic's body will lose muscle mass. Physical therapy and exercises will help minimize this problem. Pain may be associated with a lack of sensation and pain, and it will vary from person to person. A proper diagnosis will allow your doctor to prescribe appropriate treatment. Your care provider will determine the most effective treatment. If your quadriplegia is caused by a traumatic accident, you should get immediate medical care immediately. A thorough clinical approach to quadriplegia will help you make informed decisions about the type of treatment you need. Your doctor will want to know what caused the condition and if it's related to an underlying health condition. A good quality of life will ensure you live a longer and more productive life. The best way to address the cause of quadriplegia is to identify the underlying problem. For example, if you have a brain injury, you may develop a stroke. If you suspect that a spinal cord injury is the cause, you should see a doctor immediately. Your doctor may suggest MRI scans to detect any abnormalities in the brain and spinal cord. An MRI may show an abnormality in the spinal column. X-rays can also show the condition of the spinal cord. A complete diagnosis will take time, but it will be worth it in the long run. Although quadriplegia is often characterized by an inability to move, many cases of the condition are not permanent. It is possible to live a productive life and maintain a good health. The condition is not necessarily fatal and can be managed with exercise and a healthy diet. For more information, consult your doctor or a neurologist. Medical clinical approach to quadriplegia. Fortunately, a quadriplegic does not have a life-limiting condition. While he or she does not have the ability to walk or talk, he or she does have a healthy brain and spinal cord. Nonetheless, the damage to the brain and spinal cord has a profound effect on the ability of the person to function. MRI scans and other imaging tests are important in diagnosing the condition. MRIs are used to identify any abnormalities in the brain and spinal cord. Cerebrospinal fluid is used to monitor the spinal column's health. Blood tests can also detect deficiencies and genetic markers which may be indicative of a congenital cause of the paralysis. Electromyography is a test that measures the functioning of the nerves and muscles. Functional quadriplegia, quadriplegics, quadriplegics.